各位傳媒朋友，多謝大家。
Friends of the media, thank you for coming to the press conference today. The Chief Secretary for Administration, Secretary for Justice, Civil Secretary for the Civil Service, Secretary for Security, Secretary for Food and Health, Secretary for Financial Services and the Treasury, Director of Health, and Secretary for Home Affairs are all present. The Chief Secretary, the Secretary for Security, Secretary for Food and Health, and the Undersecretary for Food and Health will make some opening remarks, and then the floor will be open to questions. Friends of the media, members of the public, good afternoon. First of all, thank you for coming to the press conference. As you can see, we have two, there is me and the Secretary for Justice, and there are also other principal officials and directors here, because we have quite a number of issues to report to you today. First of all, let me stress that for the main food items in Hong Kong, including rice, vegetables, and daily necessities, supply remains normal. There is no question of insufficient import. So members of the public could rest assured there is no need to snatch such items. And then the suppliers have been coming out since yesterday to tell the public that there is sufficient supply, so please rest assured. Please do not believe in the various rumors. On the latest update on the outbreak, according to the Center for Health Protection, as at today, 9 a.m., all around the world, not including mainland, Hong Kong and Macau, there are at least 233 new confirmed cases of the novel coronavirus infection. As for the mainland, according to the National Health Commission, as at midnight last night, there are 31,361 cases, so an increase of 3,713 cases. Of that, 21,122 cases are in Hubei province, 1,018 cases are in Guangdong province. For Hong Kong, as at 2 p.m. today, the latest figure is 25 confirmed cases. 25 confirmed cases. I must state clearly that the Hong Kong SAR government has always been going by expert advice to respond to the rapidly changing circumstances. We have a comprehensive prevention control strategy. We have specific measures for early identification, early isolation, and early treatment. We also have various means to substantially reduce the flow of people and social contact. We also keep adjusting our strategies. It is certainly not like that we are doing drip feeds of measures as rumored in the community. Our strategy is similar to the one adopted in 2003 for the SARS epidemic. Now, first, on early identification, the current reporting criteria are that if the doctor finds a patient has a fever, or there are symptoms of acute respiratory disease or pneumonia, and if the patient has been to the Hubei province of 14 days, within 14 days of the onset of symptoms, or also if a patient has visited the medical hospital or has had close contact with in the mainland, or has had close contact with a confirmed case of the novel corona crisis while the patient was symptomatic, then these cases must be reported. And also for arrivals at Hong Kong, there is a health declaration requirement and body temperature check requirement. At the Hong Kong International Airport, there is also body temperature checks, and for passengers with a fever, they're not allowed to board a flight. On the early isolation, now for confirmed cases or close contacts with confirmed cases, they must go to quarantine facilities or stay at home for 14 days of quarantine. Starting from tomorrow, the 8th of February, the SAR government is going to step up this effort for people arriving in Hong Kong, including Hong Kong residents, mainland residents, and other passengers or travelers. If they come to Hong Kong, they will be put under mandatory quarantine for 14 days. In a moment, we're going to explain the legislation to you in detail. The third approach is early treatment. For all confirmed and suspected cases, the hospital authority arrange for treatment in isolation for the patients concerned. And starting from the 1st of February, the HA, the public health laboratory is doing quick rapid tests. This is so we could confirm if a patient is infected as soon as possible, and that will allow early treatment. And then because there are locally infected cases, so there is an increased risk of community transmission. The hospital authority has already activated designated clinics. The accident and emergency departments of public hospitals will continue to receive suspected cases or high-risk cases that meet the reporting criteria of the Department of Health. And then we have multi-pronged measures, as you know, to substantially reduce the flow of people between Hong Kong and the mainland. These measures include, first of all, for Hubei residents and for people who have been to Hubei province within 14 days, except Hong Kong residents, they are not allowed to come into Hong Kong. And then second measure is that through different phases, we are reducing by half the number of flights between the mainland and Hong Kong, including Hubei province. And then intercity train service and also high-speed train service has been stopped. And then we've reduced bus and ferry services. That's the fourth measure. The fifth measure is that apart from the Hong Kong International Airport, Shenzhen Bay Port, and the Hong Kong Macau Bridge, all the other border control points have been closed. And also, the mainland authorities have stopped issuing tour group visas and individual visit endorsements. So these measures have been effective. Since we have closed border control points by phases, there is a substantial reduction in the number of arrivals. In a moment, the Secretary for Security will give you the figures on the arrivals. Now, and also to minimize social distancing, the SR government has announced class suspension, kindergarten suspension, and also there are also measures to delay public examinations as necessary. And then civil servants have been working from home until the 9th of February this year. In the light of the latest developments for the outbreak, we are announcing here that we are extending the work from home arrangement for civil servants until the 16th of February. In the next 2 weeks, all statutory bodies and advisory bodies of the government will not be holding meetings because there are many outside members. And also we are appealing to employers to make flexible arrangement for employees to work so that we could reduce social contacts. The SL government will continue to follow closely the developments, and having consulted experts, we will take decisive measures in the light of the latest development. In the face of this outbreak, we asked the public to put aside their differences, and together we will fight to overcome this outbreak. Now, on the latest development, the hospital authority has assessments that there have been locally infected cases, as you know. And in light of this development, on Wednesday, the chief executive announced that the chief executive in council has decided certain measures, and the chief executive in council also called a special meeting today in accordance with the Prevention and Control of Disease Ordinance Cap 599. They will enact a piece of substitute legislation to mandate a quarantine arrangement for people arriving in Hong Kong for 14 days. There will be there will be more stringent quarantine measures to respond to the latest developments. Now, I must stress that for people under mandatory quarantine, do not show any symptoms and they are not close contacts. The Department of Health personnel will be in constant contact with them on a daily basis. This is merely a prevention measures. And I appeal to these people, especially for those under home quarantine, to shoulder their social responsibility and civic responsibility. They should fully cooperate with us so that together we can fight this outbreak. Now, for anyone who breaches the requirement of quarantine, that is commission of offense. Once convicted, the penalty is a fine of $25,000 and an imprisonment of 6 months. I must stress that this is a very important measure. In a moment, the Secretary for Food and Health and the Secretary for Justice will give you more details. I must stress that the purpose of enacting the subsidiary legislation is to further reduce the flow of people between the two places. So therefore, such measures must be more stringent rather than more relaxed. We will take a stringent approach, and then there must be effective and well-defined procedures to follow. So there are 4 types of people who will be exempted. First, for people who provide daily necessities to Hong Kong. Second, for those who have to travel for necessity. And the third type is because of the public health and other emergencies, there is need to travel. And then the fourth type is exceptional cases. But then the measure here must be in line with public interest, so there's stringent requirement. Now, for supplies that are not, say, for cross-boundary lorry drivers or, say, flight crews, ship crews, fishing vessel crews, and so on. And then for others who have to implement government measures, they are all exempted from the 14-day mandatory quarantine. But, I must stress, the Department of Health will require these people to go under medical surveillance. They must wear a mask and they must take their temperature every day. And the Department of Health will closely monitor these people. So I must stress that this new arrangement will not affect the flow of goods for Hong Kong. It will not affect the supply of daily necessities and food items for Hong Kong. So please do not believe in any rumors.
Lastly, in the past week, on a daily basis, a few thousands of healthcare workers were absent from duty. Emergency services, including surgeries of cancer patients, cesarean sections, chemotherapy, neo ICU services, and even A&E departments have been seriously affected. Some hospitals have to close down their A&E departments. I appeal to those healthcare workers who have been absent from duty to return to duty as soon as possible so that they can honor their duty as healthcare workers. We are grateful to those who have been steadfast in the post, providing services to patients, and we thank volunteers, volunteer doctors and nurses who took the initiative to help the operation of hospitals. I will now give the floor to the Secretary for Security to give us the latest figures across the borders. Since the 30th of January, the government stopped the operation of 6 cross-border points, and then on the 4th of February, another 4 crossing points were suspended. We've seen a continuous drop in the number of travelers. From the start of these measures to the day before last, that is the 5th of February, the overall number of arrivals were around 58,778, down 75%. Number of Hong Kong residents returning to Hong Kong dropped by 71%, mainlanders down 68%, other travelers down 50%. Yesterday, and that is the 6th of February, that was the only day when we saw a surge in the number of arrivals, and the total was about 145,000, up 30% compared with the day before yesterday. Those arrived by land crossing were 51,550, almost double. Yesterday was the only day of increase, and that is understandable because different categories of people had to return to Hong Kong before tomorrow when the 14-day quarantine measure would be enforced. Those who had to return to Hong Kong or return on the same day had to come to handle their various business. We believe that with the mandatory quarantine measure in place tomorrow, we'll see a substantial reduction in number of travelers across the borders, and we have prepared manpower from the Port Division Unit, Immigration Department, the Police and Home Affairs Department, and various supporting departments to implement new measures. the emergency response center at the airport, the joint command center at our border, and the emergency monitoring and command center, and also the emergency traffic control center will be in operation to monitor the operation of the whole flow and respond as appropriate. Thank you. Secretary for Food and Health. Thank you, CS, and thank you, members of the media. Just now, the CS for A gave us an update on the legal framework for home quarantine. As said, we have 25 confirmed cases in Hong Kong, and 5 of them have been confirmed to be locally infected cases. The relevant patients had no travel history during the incubation period, and no obvious source of infection could be identified. So we have seen an increased proportion of local cases, and the cases among family clusters are more obvious, so the risk of infection among family members is high, and therefore we have to step up quarantine measures to ensure that there will be no spread of the disease through social interaction and in the community. I'd like to outline to you a new measure, which is one of our ways to reduce community infection. For suspected cases and confirmed cases, as we all know, they have to provide us with accurate information. Failing that, healthcare staff cannot make a proper judgment of the seriousness of the case. This will protect the patients concerned as well as healthcare workers and the safety of the community. To assist identification by healthcare workers starting from yesterday, with the assistance of the Immigration Department, the hospital authority can now confirm whether there is any travel history for cases concerned. As for prevention and control of infection, we've always helped to stop the flow of people between Hong Kong and mainland, and also social interaction with different levels of quarantine now. There are 3 quarantine centers in operation, and starting from the 4th of February, i.e. Tuesday, we have introduced mandatory home quarantine. These are for people who have close contact with confirmed cases, or those who have visited Hubei province in the past 14 days but are asymptomatic. Wednesday, on the 5th of February, the CE announced that for those from the mainland, there will be mandatory quarantine measures. This will further suppress the flow of people between Hong Kong and the mainland, and also reduce the risk of community infection. The new measure will take effect at midnight, i.e. on the 8th of February. We'll focus on all people returning from the mainland, including Hong Kong residents, mainland residents, and passengers from other countries. Upon arrival, they have to receive 14 days of mandatory quarantine. For those who entered Hong Kong through other places, they will be subject to the same arrangement. So I have to stress that all people entering Hong Kong will have to be subject to temperature taking and must be asymptomatic. Those with symptoms will be dealt with by the Port Health Division of the Department of Health. Now, these people are considered to be less risky, and so they should be subject to 14 days of house quarantine. The family members need not be put under quarantine. And these people under house quarantine must wear a mask around the clock, and they are not allowed to leave Hong Kong. Any breach of these requirements is an offense, and upon conviction, the maximum fine can be up to $25,000 imprisonment of 6 months. So Hong Kong residents can be put under house quarantine at home. And for non-Hong Kong residents, now if they've been arranged to stay in a hotel or other residence, they will be subject to quarantine at those places. For those who refuse to accept quarantine, or if they cannot be they do not have any accommodation in Hong Kong, they will be put under quarantine in temporary residence provided by the government, and each will be given a health kit with information on good environmental hygiene and personal hygiene. And they should minimize contact with family members and friends. Every day they are required to fill out a checklist to record their body temperature as well as symptoms, if any. And during quarantine, they can ask their family members to supply them with food and daily necessities. If need be, SWT can help. The HAD and district offices will have 18 district hotline to handle inquiries. Let me stress once again that those who are under quarantine do not have any symptoms and the risks are relatively low. And these people should be disciplined, and they should observe good personal hygiene when under quarantine. I must stress that the purpose is to reduce the flow of people between Hong Kong and the mainland and to lower the risk of community infection. Under the new quarantine arrangement, Department of Health staff will assist arrivals at our borders to inform them of the new arrangements, and they have to wait for a while to go through the procedures. To some extent, that will bring some inconvenience, and I ask for understanding from the people concerned. And because of the critical situation we face, I ask for understanding, and let's work together to combat the disease.
Now, the Undersecretary will briefly go through the process so we know how it works. Now, I will now explain the mandatory quarantine process to you. After the coming into force of the subsidy legislation, for all arrivals via the land crossing or the airport from the mainland, before they proceed through the immigration counter, there will be information given to these people that as they enter Hong Kong, they will be put under mandatory quarantine for 14 days. We would also explain to them clearly the consequences. That is, when they are under mandatory quarantine, during those 14 days, they are not allowed to leave Hong Kong. And also, they must stay at their accommodation on a mandatory basis for 14 days. If there is any breach of the requirement, as the Chief Secretary and the Secretary pointed out, it is a criminal offense. Imprisonment could be 6 months, and the fine could be a maximum of $25,000. And as the Secretary for Security explained, if a person's visa if a person's permitted stay is less than 13 days, then what will happen? Well, then he'll be refused entry. In other words, if you have a visa or endorsement of only 7 days, then you are not allowed to enter Hong Kong. And then when a person arrives, then there will be a mandatory quarantine order signed for the person, and the person must fill in his address and information of for Hong Kong residents. Of course, they will have residence here, and then they will have to be stay at their home for quarantine. For non-Hong Kong residents, if they have booked a hotel or if they're staying with friends or relatives, then they may stay at the hotel or their friends or relatives' home. But of course, there must be consent given by authorized personnel of the government before they can do so. For Hong Kong residents or non-Hong Kong residents who say that they do not have an address, they cannot provide an address, or they cannot find accommodation, then the government will arrange temporary accommodation for them. Well, that type of temporary accommodation would be like closed quarantine camp. So people will have to stay there for 14 days. Now, as the Secretary has stressed that these are people without any symptoms, they have not had social contacts, they do not have a fever, because their temperature would have been checked on arrival. And during quarantine, if they feel unwell, then what can they do? Well, we have two hotlines. One hotline is operated by the Department of Health. If they have any health issues or they need advice, then they could call this hotline. There's another hotline. During quarantine, if the confinee needs any assistance, for example, if the person lives on his or her own, then the Social Welfare Department could provide assistance. For the quarantine order, it confers upon the government the power to impose conditions, and these conditions may include, for example, as the Secretary pointed out, daily body temperature check, and during quarantine the person must wear a mask, and if there are family members staying with them, then only those family members could stay there. For example, they cannot invite other friends or relatives to come for a gathering, for instance. This is not allowed. Any breach of the quarantine order is a criminal offense. Upon the expiry of the 14 days, or during the 14 days, the government may arrange surprise visit, or we may call the confinee from time to time. Now, of course, for these measures to work, the persons on home quarantine must be disciplined, and the family members must also cooperate, because as the Secretary pointed out, these mandatory home quarantine measure is just a prevention measures, and if there should be any problem, then it could be dealt with at once. Now, the floor is open to questions. Please raise your hand. Please first identify the organization you represent before you ask questions. So each may ask no more than 3 questions, please.
English question first. First question regarding the quarantine measures. Are there any other measures other than spot checks and the possible legal consequences to make sure that people really are staying at home or staying in the hotels they booked? And how should people behave when they're being quarantined in these places? And isn't that subjecting other people in the building or other hotel stayers to possible risk or higher risk even? Second question, regarding the people coming into Hong Kong these few days. I'm sure the officials are aware that mainland visitors entering Hong Kong, particularly through Shenzhen Bay Port, have significantly increased since this mandatory quarantine is announced. With this buffer between the announcement and the actual implementation, have the Hong Kong government actually already let a lot of potential cases, as some haven't shown symptoms yet, into Hong Kong, and has that increased the risk for the city and adding pressure for our medical system? Third area, regarding the Chief Secretary appeal to current and retired government workers to volunteer to help with quarantine efforts. Some union leaders are saying that some government workers are being strong-armed or pressured into volunteering to take part, even though they're scared that they might be infected. So what's your response to that? Would there be any follow-up? And has this appeal actually come too late, since the measure is, like, the quarantine is coming tomorrow, basically?
Well, let me deal with the third question, because you specifically mentioned my name here. And I will also answer in general terms the first question about quarantine, leave it to the experts, Professor Chen and also Secretary for Security, to deal with the second question. My appeal to civil servants is a sincere one, is a genuine one. We are facing really challenging times. And we're talking about social cohesion. It's time for solidarity. I think everybody in the civil service, everybody in the community should exercise civic responsibility. It's time for us to stand together. Together we stand, divided we fall, right? So we must work hand in hand to tackle these crisis situations, the virus situation. I'm really making a personal, sincere appeal. I'm telling you that some heads of departments are responding in very positive terms already. I'm receiving very encouraging emails. So any suggestion of coercion is entirely untrue. On the other hand, it's really persuasion appeal. I'm sure that a number of civil servants will respond to my appeal. So I just want to put this, put the record straight. No question of coercion. It's on a voluntary basis, as the name implies, volunteer. The first question relates to quarantine. Now, let me make an appeal here. It's, the 14-day home quarantine we talked about basically is the tier 2, so-called the tier 2 quarantine, because these people are not carriers at all. They don't display any symptoms at all. First of all, they are not close contacts, all right? And also they're under close surveillance, close liaison with the Department of Health, the experts there, every day, temperature checking, and also make sure they wear masks and all that. What they do is just to stay home. If they got any needs at all, we got volunteers to help them. In fact, the Social Welfare Department and Home Affairs Department will stand ready to help them. Anything that we can do for them, even child care, all right? Even buying the necessities, buying lunch, dinner, breakfast. And also, there will be a hotline provided by Home Affairs Department. I will invite SHA to supplement later on. But let me first hand the question to Professor Chen, all right? And followed by Gongwa, the SHA.
Okay, thank you, CSM. Thank you for your question. First of all, really, the objective of this mandatory home quarantine with the legal backing is really to reduce the cross-border, people flow, as well as to reduce the transmissibility, of the virus within the community. So the mandatory quarantine for 14 days, as CS has alluded to earlier, there are a number of checkings and also medical surveillance, as well as looking into the condition of the quarantine at home. But the whole idea is really for this person to stay at home and not to, go out, so that in case, they carry any virus, that it would not be transmitted to the rest of the community. So that's the whole idea. Other than all these initial explanation packs and also health education and also telephone calls provided to the client, of course there will be spot checks, random checks, as to see whether this person is at home. Of course, the condition of this person, whether, for example, they are having a temperature, whether they have any clinical signs and symptoms of not feeling well, would be also checked, and also for them to record themselves. And there will be periodic checking by the Department of Health colleagues, so that to monitor the situation. Of course, self-discipline is most important, because the whole idea is not to really put the person to home and having a lot of guards outside and so on. So it is not this. But then self-discipline and then having everybody in Hong Kong together fighting for this infectious disease is the most important.
It all boils down to civic responsibility here. Can I also invite Mr. Lau, SHA, to talk a little bit about the support? Because the Social Welfare Department and also Home Affairs Department underpin the whole exercise as volunteers.
We'll set up 37 hotlines to deal with those inquiries by the people under the home quarantine. And they will be run 24 hours by the staff of the HAD.
Yes, I'll hand the question to John, to Esperes.
Since the government introduced measures starting on the 31st of January, to suspend the service of 6 control points, and thereafter, on the 4th of February, another 4 control points. We can see the arrival figures have been dropping. And on the 5th of February, i.e. the day before yesterday, the total number of people arriving at Hong Kong was 58,800 roughly. That is a drop of 75% compared with the figure before the introduction of the measures. For Hong Kong people arriving, the figure is a drop of 77%. Mainland visitors is a drop of 68%. Other visitors is a drop of 50%. Yesterday was the single day we saw an increase in the number of arrivals since the introduction of the measures. It is not unexpected because tomorrow we will be implementing the mandatory quarantine for 14 days. And it is understandable there are a lot of people either left Hong Kong or left mainland to come back to Hong Kong, or they travel across to sort out some of the businesses for their own arrangement. The key really is on risk management in regard to all these human movements across the border. By introducing the 14-day mandatory quarantine measure, we will be stopping a lot of people. So in either today or yesterday, there will be people who will be making arrangements to suit themselves so as to arrange themselves, their daily routines to fit into the new arrangement. The question is, the frequency will be severely stopped as a result of the measure. So it's the frequency of the travel. That is a key factor in regard to risk management.
Next, this one in red. I'm from TVB. Well, as soon as a person is cleared, he has to receive quarantine. How can you ensure that he will be quarantined at home? Do you have to monitor his movement to ensure that he will not be walking around in the community? You talk about random checks. What will be the percentage of random checks? And if you cannot contact him during your random checks, how can you locate him to ensure that there will not be he will not be moving around in the community? And will you be using the 200 wristbands? Will you have enough? And for visitors to Hong Kong without a home in Hong Kong, you arrange a residence for him, that is the so-called quarantine camps. So will you have enough places? Will there be new quarantine camps? Because the local residents are very unhappy with new proposed quarantine camps, and how do you overcome that hurdle? I will talk about the principles, and my colleague Mr. Zheng can give you more information. As soon as a person arrives at Hong Kong, our Port Health Division from a staff will explain to him and give him a quarantine order, and will explain to him the legal consequences of not following the order and how he's supposed to behave. And that is in the coming 14 days, he is expected to be put under home quarantine. Must he return to his home? Of course, we will jot down his home address and phone number, and will call him to ensure that he is back home. As said by the CS4A, we hope that people can be self-disciplined. Because the purpose of our measure is to reduce the flow of people across the border and to lower the possibility of community infection. If all of us stay home more, or if we reduce the number of people having to go to the mainland and to return, then we can greatly reduce the risks. And as for details, from time to time, we'll go and check on him. We'll communicate with him, and I can defer to Mr. Zheng for details. As I explained just now, after entering Hong Kong, whether he is a Hong Kong resident or a non-resident, he cannot leave Hong Kong in the coming 14 days. He cannot leave Hong Kong within the next 14 days. And then, once he is put under home quarantine, we'll conduct a random check. Of course, the contact will be more frequent on the first day of arrival. We may visit his home to check on him, etc. And the question was whether there will be wristbands for tracing. Now, at this stage, we do have wristbands right now. But for the mandatory home quarantine measure to start after midnight, whether there will be wristbands will depend on the risk assessment. Those coming into Hong Kong will be of lower risks than those who were put under home quarantine previously. So we will not require the confinees to wear wristbands in the very beginning. But of course, it depends on the circumstances of the case. If he has left his home, of course, we will locate him in the first instance. For some cases, we might add extra conditions. And as I said, there is legal liability and he may be prosecuted. For those without a home in Hong Kong, they will stay at our quarantine camps. Resources are tight in this regard. But then, because of the risk concerned, they're not required to stay at our current quarantine camps. We'll arrange for other facilities as a means of accommodation.
子嘅問題咧，我都想作出一個簡單嘅回應啦。我喺呢度作咗一個誠懇嘅呼籲啦。我哋而家真係好懇切呼籲啲市民咧，特別係地區人士咧，係多啲包容，多啲諒解，因為咧，始終我哋係要揾地方嘅。大家都知道咧，我哋面對呢個問題好嚴峻，係一個長個社會嘅面對嘅問題，所以大家希望能夠就係真係互相包容咧，係政府我哋啲選址咧，其實係唔容易嘅。我哋而家有3個係即係度假村，我哋已經開做緊咧，但係數目嘅位咧，其實係唔多嘅。
There are now 3 quarantine camps being used as 3 holiday camps being used at the quarantine camps, so there are just 97 places. And then we have identified the Zhao Chung Yi Academy, but there's objection from local residents. But please do not be emotional. Please think about it carefully. This is a social issue, so we need to, work together. This is time for cohesion and mutual accommodation. And then for Pat Hang, the JPC Permanent Activity Center is another site we've chosen, but it will take us a bit of time to prepare it. So we'll continue to work very hard to look for suitable locations for use as quarantine camps. But then now we are talking about home quarantine. I'm stressed that for people under this latest measure who go into quarantine camp, they are not people with high risk. They are not close contacts. So the risk is extremely low. I'm just, as I said, it's just a precautionary measure. But even if it's a precautionary measure, we need to find a suitable place to place these people. So there's no need to exaggerate the risk. Let's remain calm. We are facing this challenge, but we must face it together. Thank you. Next, in the second row. In the second row, or the third row, sorry. I'm from Apple Daily. On the 5th of February, for arrivals from at Shenzhen Bay, 23,000 something, or that's increase of that's the number is double actually. Do you not think that this touch-based policy has been a complete failure? And then there's cross-border people who try to cross the border to seek treatment. So why don't you, if you say that you listen to experts, why don't you listen to experts sooner? Why didn't you listen to Professor Yong to close the border? Why are the borders still open? What if healthcare workers are infected? How would you deal with that? And then you mentioned 4 types of people. Some people will be exempted, like flight attendants or lorry drivers. Is it because they are stronger, they have better immune system, so they don't need to be put under quarantine? And then for the 25th case today, could you give us more information? Is it a male or female? That is the confirmed case at the Prince of Wales Hospital. Thank you. So there are 3 questions. Professor Chan will take the 3rd question. And if I may just say a few words, and then I will hand over to other officials. Now, Secretary for Security explained the figures to you. You can understand why it happens, because at midnight tonight, the mandatory quarantine measure will come into force. That is home quarantine. That's why people are rushing back to Hong Kong. We can expect that to happen. So please don't just look at the figure of yesterday. Look at the figures over the past 3 days. On average, we're just talking about 2,000 plus people. Of course, yesterday there's a surge in a number of arrivals because people want to come back before midnight tonight. On other points, flight attendants, perhaps the Secretary for Justice could give you the legal angle later. But for all these this personnel, including lorry drivers, cross-boundary lorry drivers, Hong Kong needs to keep, up the supply. Otherwise, you don't get supply, so we need to allow them to operate. And there will be medical surveillance for such personnel. They have to take body temperature, they have to wear a mask, and if they're not well, they must immediately inform the Department of Health. So there is close contact between the Department of Health and these people. It's not that these people are on their own. So but at the same time, we need to make sure there is normal operation. So we need to strike a balance, and we believe this is the right balance. Secretary for Justice, do you have anything to add on the legal aspect? If not, then I will invite Professor Chen to speak. Perhaps first I will invite Dr. Constance Chen to give you more details about the 25th confirmed case. Case number 25 is a 58-year-old male. He lives in Zhuhai and Hong Kong. He works in Zhuhai and Macau. On the 4th of February, he had a temperature and he started coughing. And then on the 5th of February, he arrived at Hong Kong. He went to see a private practitioner. On the 6th of February, he went to the Northern District Hospital for treatment, and he was put in isolation. His condition is stable. According to the information from the patients, during the incubation period, he worked in Zhuhai and Macau. On the 5th of February, in the afternoon, he took the golden bus from Zhuhai to come to Hong Kong via the Hong Kong-Zhuhai-Macau Bridge control point. After that, he took the airport bus to go back to Shangshui. At 9 a.m. on the 5th of February, he took a taxi in Shangshui to go and see a private doctor. On the 6th of February in the morning, he took a taxi to go to the Northern Hospital for treatment. The Department of Health is now carrying out epidemiological investigation and contact tracing. We will also inform the WHO and the relevant authorities of Macau. and the mainland. Anything else from you, Secretary for Security? On the 31st of January and the 4th of February, we closed a total of 10, or we suspended a total of 10 boundary control points, and the number of rifles kept dropping. So we need to look at the overall trend. Another point, we see that the figures went up yesterday, and as I explained, we could expect that to be the case because tomorrow we're going to implement the 14-day mandatory quarantine measure. So before this measure comes into force, people would want to come back to Hong Kong or go back to the mainland, or they want to go back and forth to deal with certain matters. Now, if we just focus on the rise of figures in a single day, and we don't want to see the reason behind that, and then it's not the full picture. So after the 30th of January, we put in place various measures, and then we should look at the substantial drop in the overall figures. And then tomorrow, we're going to implement a 14-day mandatory quarantine measure. So we will expect the number to drop substantially. The lady in red. I'm from the Hong Kong Economic Journal, Chief Secretary. First question. The government has announced that starting from tomorrow, people arriving from the mainland will be subject to 14 days of mandatory quarantine. But what about people coming back from other places? What if people go from Beijing to Thailand and then come back to Hong Kong? Can they then evade the 14-day quarantine requirement? And what about non-Hong Kong residents who check into a hotel for quarantine? Well, this morning, Professor Gabriel Chen alone said that a hotel quarantine does not work because of poor ventilation and so on. How come you think it could work? Third question is on the penalty. Professor Chen said that you rely on the self-discipline of people. But what if people are not disciplined? They leave the hotel. How do you enforce the law, and how do you track those who have breached the law?
If I may have a go first. Regarding the mandatory quarantine arrangement, of course, we have a legal backing and in the form of a quarantine order, which will be explained to anyone arriving at Hong Kong by the Port Health Division staff. So everyone arriving in Hong Kong will be subject to the 14 days of mandatory quarantine. He might directly coming from the mainland. An important thing is he has been to the mainland in the past 14 days. Regardless of the origin of this trip, so long as he has been in the mainland in the past 14 days, he will be put under the mandatory 14-day quarantine in Hong Kong. For a non-Hong Kong resident who is going to stay in a hotel, as I said, the quarantine arrangement they're going to receive is different from those who have to be isolated because of symptoms. In the latter case, he is already a patient and he has to receive treatment in isolation in a hospital. Now, for these group of people, they are subject to home quarantine. They will be home confinees. They will be given a health pack, and they should reduce social contact and should stay home. And day in, day out, they have to go through a checklist. They have to record the information required From time to time, our Department of Health staff will call him up to check on his health conditions. That being the case, self-discipline and prevention are the most important things, and most important of all, he has no symptoms. Can the Secretary for Justice take the question about penalties? Well, the question is very simple. If he has violated the quarantine order, he has committed an offense, and the relevant law enforcement agency can then arrest him and prosecute him. How can we track him down? Such a person is not allowed to leave Hong Kong. So investigation is needed. I believe the law enforcement agency will have the means and ways to track him down, and I hope that will be the last resort. As repeatedly said by the CS4A and the Secretary for Health and Food, we want everyone to exercise self-discipline in Hong Kong. The terms are very clear in the quarantine order, and complying with it is not just for Hong Kong or anyone else, but for his own sake. He should comply with the order to ensure his own health and also the health of his family members as well as the whole of Hong Kong. Deputy Secretary for Food and Health. Under the regulations, if a person has been in a place outside the mainland, well, he may be arriving from a place other than the mainland. So long as he has been in the mainland in the past 14 days, he will be subject to the quarantine order. Last two questions.
Morning Post. So first of all, I'd like to ask that regarding we're expecting a large amount of people that would require quarantine, has the government actually identified new locations for quarantine apart from the 3 holiday camps, which could only provide 97 units? And you mentioned that for people who do not have residence in Hong Kong, they would maybe be quarantined in hotels. But what if hotels refuse those people to be quarantined there? And if those hotel staff, do they have a duty or obligation to monitor those people in quarantine? And also, I'd like to follow up a question previously asked by a Chinese-speaking colleague, saying that advice from Professor Gabriel Leung saying that hotels actually are not suitable for quarantine because the ventilation system might allow the virus to spread through the entire building, even though the people, they might be asymptomatic. Why does the government still choose hotels as one of the quarantine sites? Thank you.
Well, let me deal with the first question first. The people ordered to go into home quarantine, basically they are so-called low risk, tier 2, all right? Tier 2. That's why they are not close contacts of confirmed cases, and they do not display any symptoms at all, and also is under close surveillance and also close contact with the Department of Health and so on. So they are under regular surveillance all the time. All we have talked about is really for them to spend 14 days on their own, all right, in isolation, as it were, and with full support rendered to them and their families as well. So we are talking about a special categories of so-called people under quarantine. Now, as far as venues are concerned, so-called the centers are concerned, if we're talking about home quarantine, the problem is solved. Basically, we're talking about home, all right? They've got their own places to live, to operate. For those without accommodation, we've got to provide them with accommodation. The challenge, therefore, is to find enough and suitable venues. That's why we're now doing our best, searching the right sites. That's why we call on the community, whole entire community. Citizens of Hong Kong exercise or civic responsibility, time for solidarity, time for understanding, a time for particularly social cohesion, as I always stress the word social cohesion, with time for us to stand together to face the crisis. All right? So, any other thing you want to supplement?
Perhaps I can invite the Director of Health to talk a little bit about the conditions of places whereby we think it is suitable or not suitable for quarantine. As I think earlier, we talk about the different risks. For example, the quarantine camps that we have now placed the close contact of confirmed cases in, I think those are of the highest risk because they are close contact of the confirmed cases. We've also put on quarantine a category of people who came from Hubei. So these people are put on home quarantine. And now we are talking about people who are coming from any parts of China in the last 14 days. So the risk level is different based on the assessment by the Department of Health. So,
well, under the existing legislation, there are two types of order, namely the isolation order, and the second one is the quarantine order. So isolation applies to patients, infected persons. So if there's a case who is highly suspected to be infected by this novel coronavirus, and also for confirmed case, they will be managed in a hospital under isolation. And once confirmed, they will be held there and kept there until they fully recovered. So that's for isolation. As for quarantine, there are several types of situation when quarantine order will be issued. In the past, we will consider the close contact of confirmed cases. By close contact, I mean, for example, household family. For example, if traveling on an aeroplane, the passengers sitting within a radius of 2 seats of the confirmed cases. So these close contact, so defined, will be put in quarantine centers. The familiar ones, which you will know, will be like Lady Mackelho's holiday camp. So those are the close contacts of confirmed cases. So with the passing of the new emergency regulations, which takes effect tonight, it applies to anyone who has ever been to mainland China in the past 14 days. So they do not fulfill the criteria of, say, having been a close contact of a confirmed case. So they are simply anyone who has ever been to the mainland China in the last 14 days. But because of the fact that we want to achieve two purposes, namely, reduce cross-boundary movement of people, and secondly, to ask those who have been to the mainland to stay at home. In the past, we advise people to stay at home for 14 days if they have ever been to mainland China. But we think because with the recent appearance of more local cases, we think it is important and essential for these people to be applied a more stringent measures. By that, instead of just advising them to stay at home, we mandate them to stay at home. So these people are relatively low risk. That is why we adopt a different level of quarantine, having done the risk assessment.
Next, the one in purple. I'm from TMHK. For people coming from the mainland that have to be put under home quarantine, I'd like to know whether they're going to reach their homes by means of public transport, or will there be transport arranged for them? If they're expected to use public transport, will there be the possibility of transmission in the community? And how can you ensure that he will eventually reach home? Now, if in a household there is such a member requiring home quarantine, he may be living with his family members. Does that mean that his family members can have free movement in and out of his home in the past 14 days? But would there be the possibility of the confinee infecting his family members who are allowed to move freely in the community, causing a risk of infection in the community? And for random checks, can you tell us your team of staff conducting random checks, How much deterrent effect is it going to do? Will there be more than one random check on the same day? Will there be the possibility that after one random check, the confinee feels safe to go out for a while? Government officials have reiterated time and again that this group of people have lower risks. Why are you so assured? Because the number of confirmed cases in the Guangdong province is among the highest in the mainland. How can you conclude that those returning from the Guangdong are low-risk cases and there will be no risk of transmission?
First, the Undersecretary. Now, for this mandatory home quarantine arrangement, family members are not required to stay home for 14 days. As we said, this is really a question of risk management. Now, during the mandatory home quarantine arrangement, the confinee must take his body temperature every day, and if there's any sign of illness or mask must be worn. Now, you ask about random checks. Now, who will do the random checks? There are two types of people. One is Department of Health colleagues, and the other are police officers. So we will see how many people are put under home quarantine, and then we'll adjust the manpower accordingly. So it's hard for us to say how many people will deploy for the random checks. Of course, the measure will come into force at midnight, and because of this measure, we expect there will be a substantial reduction in the number of arrivals. Now, in the whole design of this arrangement, self-discipline is vital. Now, about people leaving the border control point and going home on their own, well, as it was explained before, the risk is not like they are. It's not like that for close contact, so they are free to take public transport to go home. But of course, they would have left with us their phone number, and as soon as they leave the border control point, the contact will start. If I may explain, among our various public health measures and prevention and control measures, mandatory home quarantine measure is, of course, important, but this is not the only measure. Now, we want to reduce the flow of people across the border. When we first learned there were many cases in Hubei province, immediately we refused entry to Hubei residents and those who've been to Hubei within 14 days. And then we also suspended certain control points. Now only 3 control points are left where there could be departures and arrivals. And of course, we are also closely monitoring the developments of the outbreak. We look at the situation on the mainland and in Hong Kong. And of course, we know now that in Hong Kong we have some local infection cases. So that's why at various levels we have strengthened the measures. So this home quarantine measure is important, but let's not forget at the boundary control points there is always body temperature check, there's a health declaration, and then there are staff of the Port Health Division stationed at the BCPs. The Center for Health Protection and the hospital authority have expanded the scope of surveillance on several occasions. Now, with expanded scope of surveillance, we are able to identify certain cases. At the same time, the hospital authority has stepped up its own surveillance. For example, where there's unknown pneumonia cases, and as I explained just now, for patients, now the HA is working with the Immigration Department. So at the Accident and Emergency Department, doctors will be able to find out about the travel history of the patient, even if the patient would not disclose it. So the doctors there would know if the patient has left Hong Kong in the past 30 days. So this would help with diagnosis and with obtaining patient history. And then yesterday, we also mentioned that the hospital authority's designated clinics are now ready. Now, if we have more cases, then these dedicated clinics could deal with the milder cases. And for people with symptoms, they can go to these clinics and we can verify whether they are infected by the novel coronavirus. So we have a multi-pronged approach at various levels to to fight the outbreak. That's the end of the press conference. Thank you for coming.